It's your time to live well, and you have tuned into the Holistically Speaking podcast, where we're teaching you to be well and be whole in your body, your joy factor, in every season and pivot of your life, in your mental health and your well-being. Are you ready for this episode? Excellent. Tune in. You won't be disappointed. Yes, there I am. There we are. Hey, everybody. Hey, it's your well woman practitioner, Lashana Moore of Holistically Well, the Holistically Well Center, as a matter of fact. And I am so excited to engage with you and talk about a conversation and an issue and a challenge and a debate and all of that stuff that has been a part of our community, a part of our society, a part of pop culture, a part of this world. And as long as all of the planets are rotating and evolving, this conversation has been a huge topic. And it's talking about obesity and overweight and what constitutes as healthy. We're going to have that discussion. So listen, this is for not only my women, but also my men. Men, I want you to grab your wellness tea in this episode and pull up a chair, a comfy seat, and listen as I share with you some variables, some benchmarks, educate you, to empower you. That is what it's all about. Our motto is always centered on being well and being whole. And that's your entire being. That's from the inside out. Your mind, your body, your soul, your spirit, as well as your community, your village, your surrounding, your location. Everything about who you are and where you are is a part of your being well and your being whole. And I'm very blessed to do this work, and I'm very blessed to be with you. And we're going to jump into this episode because it is a conversation that often strikes up a lot of emotion, a lot of confusion, a lot of debates. And so we want to get down to the nitty gritty of it all so that you will know how to gauge where you are in your body, in your life at every phase. So as you're maturing every year, every 5 years, every decade, you will be able to have stable benchmarks to know whether or not you're living, and I'm going to use another word outside of healthy, an optimized, a maximized life in an optimal body. Does that sound good? Sound fair? Sounds like a definition that covers all of the aspects of being well and being whole? Yes, because it does. Sometimes I refrain from the word healthy only because now in the dynamic of this health and wellness industry, a lot of words have become buzzy. A lot of words have become fad. A lot of words have become trendy. A lot of words have become hierarchical. A lot of words have become racial. A lot of them have become systemic. And so we want to make sure that on this life journey, it's not a destination, it's not a finish line. On this life journey of being well and being whole every day, that our words and our definitions line up to that which is true, that which is balanced, that which is stable, that which is factual. And so as we prepare to get into this conversation, I'm going to ask you to take a look online at the disclaimer. As we go into this conversation, you know that we always mention and share with you that this information that's shared on these episodes are the beliefs and opinions of the host. That's myself. Health topics are not designed to treat or cure medical issues. Consult your physician for that. And any episodes that we cover regarding a spiritual or an inspirational practice or concern or thought usually comes from the foundation of our Christian faith. So with that being said, welcome, welcome, welcome. All right. Next thing that we're going to do right before we hop into this conversation is go into our WEtreat moment. And that is our moment where we are able to stop what we're doing, settle our flow and our rhythm, settle our minds and our breathing, and find a center of stillness and peace through breath. Clear our mind, clear your thoughts, clear the traffic that's in your head, as well as relaxing the body, the chest, the forehead, the jaws, the neck, the shoulders, just the body, unclenching jaws, unclenching your fists, all of those kind of things. And you'll always be surprised that many times during the course of the day, you've not stopped to do these things because life is demanding so much of you. So we're going to do that now in this moment with our sisters of beautiful courses. Deep breath. Yeah. Inner peace, peace that comes from knowing, the peace that comes from our center, which is our creator, which is God Almighty. Peace that comes from knowing that tomorrow will take care of itself. And today we have the grace to handle the things that are before us. Peace that comes from knowing that everything is figure outable, that there is a resolve, there is a solution for everything. It may not come today, and it may catch us in a moment of being uncomfortable and a moment of discomfort, but we have assurance and we have the track record in knowing that everything will always work itself out. We are thankful for that grace that we've been given. So shall we, yes, walk into this conversation? And I think what I'm going to do also for those of you who are watching is make some notes for you on the screen, because I'm just kind of interactive like that. And that is the teacher in me. So we're talking about overweight and obesity. Can you be overweight and healthy at the same time? We are living in an age where body positivity, self-worth has marched to the forefront. It's a beautiful thing to see because it is enlightening those who have had very harsh, unfortunate experiences within their homes, within their community, within school, whether it's been bullying or something that someone has said to you, or maybe just a failure to see yourself and your image represented in media, in print, and I can't say in everyday life because we see a variety of bodies in everyday life, but I won't take for granted those of you who may not. So you've experienced possibly situations or words that did not feel good. And with this body positivity and the self-worth that, as I said, has marched to the forefront, it is allowing men and women to awaken into appreciating and loving themselves. What I want to do, and my mission, is to bring in a balance of what it means to make sure that you're living in an optimized body while still recognizing your self-worth, your value, and not just being positive about your body, but loving and appreciating your body. I don't want us to misinterpret body positivity as ignoring the needs of the body because trauma forces us or has forced us to look at the extreme for the sake of coping with our bodies in a very intense, inflamed, rude, critical society. I want us to be able to find the balance and the margin, the median, should I say, the median in optimal living, in an optimal body, with an optimal mindset, and appreciating that. And so that's what I'm going to share with you, this information that I'm going to share with you today. I also want to give thanks to University of Chicago and, of course, NIH, PubMed, are some of the resources that I use along with years of experience and working with clients and working with women all over the world. I am very thankful and honored for God to trust me to do that and for women to trust me to do that. And then every now and then men who I've had a privilege to work with who have asked, LaShanna, I know women, you know, the group of women is your thing. That's usually my audience. That's my demographic. But can you help me with this? And just so that you know, although I don't do consultations anymore, I am always open to helping our men. And as a matter of fact, with June, at the time of this recording, June being Men's Health Month, I will be sharing before the close of the year, close of the month, some very important episodes for our men and their men's health. and men health. So I want this to be something that men and women both constitute as necessary and applicable, because it is. The first thing that we have to do is define what is overweight, excuse me, and what is obesity. And so there are various definitions of obesity and overweight. It's based on the medical definition as well as Merriam-Webster's definition. And I'm going to share them with you. And I'm going to kind of go onto a little side trail with that, because you know I do that. I love a nice little detour that brings everything together, like a nice gumbo or a nice goulash, a nice stew, a nice soup, you know, whatever you want to call it, wherever you're from. But I love when all of these different variables come together and bring you a big picture of understanding. So the definition of constituting overweight has varied. It was once determined by the BMI, the body mass index, along with other factors. However, and thankfully in that however, the AMA, the American Medical Association, has just, not, I'm going to say just, because it started January of this year, January of 2023, has changed their policy and even their practice, their pathology of enforcing the BMI policy. And I'm so glad. Okay, I'm sorry, but we're going to have to do a round of what? Applause on that one. Because listen, many of us have been advocating for years, and many of us have been saying for years that the BMI is not a fair and accurate way of assessing a person's health. And so for those of you who have had negative experiences in the doctor's office about your weight or the status of your quote unquote health based primarily on the BMI, my apologies to you for that. Let me go on and share with you what's going on. So they have acknowledged, as many of us have known, that BMI does not factor in age, race, ethnicity, sex, or gender. BMI same measurement used for a 39-year-old compared to a 65-year-old, or the everyday person compared to a bodybuilder or a competitor or someone who's in extreme sports. It gets very jaded. It gets very muddy and murky when you try to base someone's health by the BMI only. So BMI was actually, here's my side note here. Here's a little road detour. Just if you're not following on social media and have seen me share this, I've shared it on Black Bodice as well as Holistically Well Center. But the BMI was founded by a Belgian polymath, a person who studies numbers. He was obsessed with numbers. This is like the mid 1800s. And he was seeking the perfect formation of the average man. The average man, which, by the way, is the premise of a lot of the standardized testings that are in our medical space, even today. It's based on the average Euro male. So he's a Belgian polymath. He's obsessed with numbers. He's seeking the perfect formation of the average man. He created these mathematical laws that govern human population. Side note to that, the man's name, I'm going to attempt to say it correctly, Lambert Adolphe Cotelet. So now, whereas he wasn't a eugenist, and a eugenist is a person who believes that they can perfect human beings and eliminate so-called, that's in quotes, social ills through genetics and heredity. That's what eugenics do. They believe that they can bring solution, bring resolve to these social ills and genetic and hereditary issues. They believe they can. And so although he wasn't a eugenicist, his ideas influenced many of them. One, namely, being who we have marked as the father of eugenics, Francis Galton. And it influenced him and influenced his methods, and his methods became the foundation for scientific racism. I know you've heard it once, you've heard it all before. Heard it all before. You have. And every time you hear it, let it be a marker, let it be a bookmark in history and in the present, that so much of what we view as the staple of health, as the ideology of health, stems from some sense of racism. Again, this is from the mid 1800s. And it's a little sad that although there has been some progression within the industry, we still see and experience a lot of this today. Reports and research back that up. You know, I'm not going to give you anything faulty if I haven't researched it. But at any point, this is a huge subpart of the skewed perspectives and options of what people deem as, I'm putting it in quotations again, healthy. And most have assigned the status of health by the visual, the exterior, the body. Let me say something real quick. I'm on LinkedIn. I'm still a lover of Twitter because I like to have conversation. Now there are thoughtless people on all of these platforms. Sometimes I like to engage on Twitter because they're talking about issues that I like to discuss. And Twitter is a platform meant for you to go back and forth and have conversation and dialogue. I'm a person of, I guess, social media etiquette. For me, Facebook is not that space. For me, Instagram is not that space. Twitter is that space. And on certain topics of discussion, LinkedIn is that space. So I was on LinkedIn, and there's a forum that I'm connected to. There's a group that I follow, and I got really perturbed. Listen, because I'm going somewhere with this. They were talking about health and eating and just eat clean and eat healthy and just all of these broad, faddish words that don't streamline any direction that can be proven for the general public. And then this lady posts a before and after picture of herself. Apparently she's lost weight. And under the picture, she writes, "Just eat clean." At that point, I could not hold my peace. You know, some stuff you watch, you can look at it and you scroll and go on because they're not your battles to fight and it's not worth your energy and your time. But since I am a part of this community, I was invited to be a part of this community, I was not going to hold my peace. So I went on to ask her, what does this picture mean and what does your phrase mean? Now, you have been in a place where you've been unhealthy or overweight or obese. You have found the light, or at least the light for this time and season in your life, and you're living good in your body. You're excited about it, but now you've flipped the script and you've become critical of others by saying just eat healthy. And you didn't just eat healthy. You had a regimen. You had to learn something. You had some sort of process. And so that's to make a long story short, that's really what I challenged. I challenged them not to be general. And also because I do a lot of work with people that are in in areas of disparity, communities where there's not a lot of resources and there's not a lot of finances to go to all of the fancy bougie stores and do the organic and to do this and that. You've got to help the less than person be well and whole in their body. And here's my thing. If you can't teach and instruct and guide someone who does not have the wherewithal financially to do all of these wonderful, beautiful, sophisticated things, go to the Trader Joe's and the Whole Foods and the Sprouts and all of these other stores that just make you feel. It's a feeling. It's a feeling of privilege, whether you're black or white and you do it. It's a feeling of privilege, and it is an ego trip that makes you feel like you're being healthy and you're spending extra money because there is the presumption that more money means more quality, that more money means health, that more money means that it's right and good. And that could not be farther from the truth. So if we cannot break down living well and whole to the bare bones and help the person who makes $4, $5, $7 an hour, who has an entire family to take care of, if we cannot help and instruct them, then everything else that we're teaching really is null and void. It is privilege. So I had to share that. All right. I'm back on the main road now. I'm back on the main road. So anyway, let's talk. We're talking about the definition of being overweight. So we've already ruled out BMI. That was the whole purpose of that segment that I just came from, that we cannot rely on BMI. and that AMA has already changed their policy on enforcing that and using that as a regulation or as a marker to determine whether or not you are healthy. So the question, so not the question, but the first acknowledgement that I want to, or explanation that I want to share with you is that you can be what is considered overweight and still healthy. Yet at the same time, we know that obesity is a disease. It's a disease that that affects the body in many different ways. So there is a fine line in being what is considered as obese and overweight. The Merriam-Webster meaning of overweight is weight over and above what is required and allowed. Sometimes you can tell this by the way that your body responds, by the way that your body is carrying additional weight. For some of you, it's 20, 30, 40, 50 plus pounds than your norm. So to vary by 5 to 7 to 10 pounds is not so bad. As we get older, we are losing muscle mass. Our bone health and structure is changing, and consequently, as well, your weight is going to fluctuate as hormones are changing and other things are taking place. So 5 to 7 to 10 pounds, that fluctuation is not so bad. But when you begin to gain weight that's being added in certain places that we're going to talk about in a minute, and your body is responding in a hardship, your breath, your oxygen, the way that you're able to breathe, if you're running out of breath, if your joints, if you're starting to have issues and aches and pains and restrictive movement in your joints, if you're seeing that it's starting to bring on additional problems, then you want to consider whether or not you are obese and overweight. The medical definition, according to the BMI, we're going back to the BMI real quick, because this is not the marker. This is not the Bible. This is one variable. 27.3% or more for women and 27.8% or more for men. Now, I am going to say combine that with body fat, fat to mass ratio, visceral fat, insulin resistance or insulin stability. We're going to get into that in a moment. While we're talking about variables of determining whether you're healthy or not, let's hit this scale debate. Is the scale relevant? If you know me, you hear me often say, when it comes to that scale. Get off the scale, stop weighing yourself every day, because it is just one data point. Now, we all like the sound of being a certain weight. And that mainly came from probably a doctor that you had an experience with, or society, pop culture, print, magazines, editorials, the modeling industry, commercials. What we have, the picture that we have painted of sexy and acceptable and body image in this country. The scale, people brag about being X amount of pounds. There is a truth, which is why I said it's one data point. It's a part of a bigger picture. There are other factors. I just mentioned some of them. Your fat mass. Okay, you want to know what your fat mass is. You want to know what your fat to muscle ratio is, meaning how much of your body's ratio is fat versus how much of your body's ratio is muscle. You do want more muscle than fat. You do need a certain amount of fat and a certain type of fat. And then you want to also look at the correlation of your waist. Now, if you're looking at your waist and snatching your waist from a vanity perspective, I'm not blaming you for that. I'm not faulting you for that. I want to look good for myself too, for myself first. My husband will be the beneficiary of that. Of course, unconditional love is there. He loves me regardless. That's all great and kind. But for me, I want to look great for myself first. So whether you're looking at it from a vanity perspective or because you're trying to get off medication or whatever the reason is, whatever your reason is, which is fine as long as it is healthy and not addiction based, then you do want to watch the circumference of your waist. I'm getting ready to go into that. So these are all variables that you really want to look at. You want to look at the quality of your life. You want to look at your blood pressure, your fat to muscle ratio, your fat mass. There's a correlation with weight and life expectancy. That is a truth. So it has been researched and it has been documented that based on how many pounds over you should be, and you know your body. So you know how your body is responding. You know what your test results are starting to read, your blood pressure, your sugar, your triglycerides, your cholesterol. Look at those tests, and your doctor will have that discussion with you. You want to set realistic goals for yourself. Yes, you can factor in age, you can factor in height, but it is also about the quality of your life. It's about the activity level of your life too. It's about the optimization of your life. Are you moving regularly? Do you exercise regularly? I'm not talking about training for an hour and 2 hours a day, but are you regularly exercising? Are you elevating your heart rate? Those are things that you want to look at in terms of realistic and segmented goals. Segmented goals are, okay, I know I've got to lose 50 pounds. I've got to lose 100 pounds. I've got to lose 200 pounds. I'm considering gastro or sleeve surgery, but I've got to lose X amount of pounds before that. What is the mindset that I need to have before I have that surgery? Or if you're not in a critical situation where you don't have to have that surgery, but you know you've got to lose 100 pounds, then you take it in segments. And not only do you take it in segments, but you've got to condition your mind to understand how you're going to go about this process and what your variables are, your factors, your benchmarks, the things that I just mentioned. Not that I'm dropping weight, but I'm also building muscle, because my muscle is linked to my metabolism. The more muscle I'm able to build, the stronger my immune system can also fight out foreigners and invaders in my body. So, we can relish in the vanity of it, but there are some extreme benefits of it as well, for your immune system, for your body's structure, for your strength, for your hormonal balance, for your metabolic function, for your adrenal health. Muscle is more than just a look. Muscle is health. Muscle is survival. Amen. All right, so we help those who are in the medical or the holistic space. We help patients / clients come up with practical, realistic, and segmented goals, not just depending on the scale. We're talking about the scale. I want to move on from here. You ask your person, you ask your patient, your peer, your client, what's one of your goals? Sometimes a goal may be, well, I want to be able to play and run around with my kids or my grandkids without losing my breath or without being out of breath. I want to be able to travel. I want my doctor to be able to clear me to get off of this medication, or my doctor to clear me to travel overseas, because there can be a velocity and an atmospheric pressure concern for certain people when you're traveling long distance for a long period of time when it comes to blood circulation and all of that stuff. So what we want to do is encourage metabolic health. I've talked about this in a previous audio podcast about what a lot of people are dealing with is poor metabolic health. And if you are a Black or brown person listening or watching this episode, that definitely pertains to you. Sometimes it is genetic. Sometimes it is lifestyle that changes your metabolic health and lessens your metabolic health. But we want to encourage a strong metabolic health. We're talking about being healthy or being optimal in your body and considering what is overweight and obese, and is it a thing? Primarily, doctors say yes, you can be quote unquote overweight and have a healthy body if you clear some benchmarks. And I'm pacing myself, so that's why I slowed down. And I'm gonna talk about it in a minute. I want to go to this metabolic health real quick though. And then I'll give you your checklist. I'll end with giving you a checklist and wrap this puppy up with a summary and let you go on about your day and being well and being whole. How about that? So we want to encourage metabolic health. And a lot of people struggle with metabolic health, particularly once you hit your 40s, and particularly if you are a Black and brown person. These are conditions that are going to increase your risk of heart disease, stroke, type 2 diabetes, increased blood pressure, increased blood sugar, excess body fat around the waistline, which I just spoke about, abnormal cholesterols, and elevated triglycerides, which elevated would be 240 milligrams per deciliter or more. I'll type it out. Pause and see, La. I want you to see it. 240 milligrams per deciliter or more. Abnormal cholesterol levels, triglycerides. So when those levels are too high, what happens? This is what puts us in the danger zone. Fatty deposits are more likely to build up in your arteries. When that happens, it's going to make you more prone to heart diseases. It's going to make you more prone to heart diseases, and that's what you do not want. So we don't want to walk around again. Here is that safe and wise balance between body positivity and asking yourself the question, am I living in an optimal body? Am I living in a relatively healthy body? Am I living in a body that cancels me from the different checklists, from the checklist that I'm getting ready to share with you in a minute? So we're on metabolic health real quick. I want to share with you some of the signs. I'm going to type this in too. So if you are listening, you know, I always tell you, come on over to Well Life TV and check it out. All right. So let's go through some metabolic symptoms and signs of poor metabolic health. The first one is going to be insulin resistance. Repeat after me. Insulin resistance. I talk about this one a lot when I'm sharing about reproductive issues or endocrine disorders, namely PCOS, metabolic symptoms, insulin resistance. But it's also a truth that by the time you have reached menopausal stage, or for men, menopause, which will be a part of our men's talk, and your 40s, that you are going to experience some form of insulin resistance, whether you're diabetic or not, because of your metabolic function. Things are changing. So insulin resistance, you can also consider elevated blood sugar, is when the cells in your muscles, your fat, and your liver do not respond well with the insulin that your pancreas is releasing. And what it does is, so the liver, the muscles, and the fat don't respond well and to the insulin, and is not able to take up the glucose from your blood. So as a result, your pancreas starts to make more insulin, trying to overcome your cell's weakened response to the glucose. And it's a cycle that just continues to do that. And your body's not able to keep up with the amount of insulin that the pancreas is releasing. Those are, you know, it reminds me of an autoimmune issue where the immune system is starting to attack itself, thinking that it's trying to help itself. So insulin is a hormone that's made by the pancreas, as I mentioned, and it helps glucose in the blood to enter into the cells, the muscle, the fat, and your liver. Glucose comes from our food. Our food should be converting itself as energy, but one of the symptoms, the second symptom, if your food is not converting itself into energy, glucose energy, then you feel low energy. That's the next one. That is the next symptom. You're feeling low energy. We're talking about symptoms of metabolic disorder or poor metabolic health. Low energy, sluggishness, fatigue, frequent complaints. Listen to this one. Frequent complaints of stress, a random boredom that you can't shake. You can't meditate it away. You can't pray it away per se. You can't read an article and improve it. You can't get rid of it. It's a different kind of boredom. Or if you're complaining constantly about not getting enough sleep, you just cannot get enough sleep. Daily dips in your energy. You're experiencing an energy slump the same time of the day, or at some point in the day. That is usually from an irregular glucose swing that happens in the body. All right, let me move on. The next one would be difficulty losing weight. Is that one? Is there one? Is that you? Is that you? Yes, this one has affected many of us. It has affected me because I have definitely had insulin resistance. The one symptom you can usually physically observe. Others have to be done through a test. Your cholesterol, your blood pressure, your triglycerides, your sugar. But the one that you can physically observe is the weight gain. This is a symptom of poor metabolic health. Research has found that being overweight or obese is the primary reason metabolic syndrome affects 30 to 40% of people by the age of 35. Is that you? Yeah. Yeah, I know this is sounding familiar to many of us. Let's move on to the next one, shall we? And of course, you can always replay this. The next one is, drum roll, please, brain fog. Side note, brain fog is not a medical diagnosis, okay? But the lack of mental clarity, difficulty retaining information, that can occur as a result of lack of sleep. That can result as depression, as a response to depression, not enough exercise, hormonal changes, this brain fog. And so our brain requires fat, healthy fat, but our brain requires fat because our brain is made up of a portion of fat, okay? Our brain also requires glucose to function, energy to function. It's the cognitive function. It feeds off of that. And so scientists believe that brain fog can be a result of two different metabolically related pathways. That's a dysregulation of your glucose. It's not regulated. And the triggering of neuroinflammation in the brain. That can be a part of lifestyle and diet, lack of sleep, lack of exercise. All of those things can be triggers for that. So brain fog is another symptom. All right, let's move on to the next one. Let's go, let's go, let's go. Here it is. Ooh-wee. Is this you? Mood change. Change can be affected actually by spikes in the blood sugar after a high glycemic meal. What is a high glycemic meal? A meal that's loaded in a lot of sugars, a lot of different kinds of sugars. It's not very well balanced in the sense that you're getting a good protein, some good fibrous carbs, some vegetables. You're not really eating a variety of foods that are loaded with vitamins and minerals and nutrients and antioxidants. And it's frequent. And if you are insulin resistant, poor metabolic health, your mood can be affected by that. The last one that I want to mention is going to be, excuse me, acne, namely adult acne. Do you have acne? It can be caused by stress, hormonal changes, some meds that you may be on, your diet, but also lower glycemic meals can be helpful for that. So like the examples that I just shared with you about having a healthier diet that's loaded with antioxidants and phytonutrients, minerals, and I'm revamping my lips. Minerals and foods that are going to fuel and convert into energy and not stored fat. All of these are markers concerning poor metabolic health. All right, let's take that one off and let's move to the markers. I shared with you that I would let you know what your benchmarks are. So let's go to the waistline. Markers for overweight and healthy. If you are overweight, meaning that you are over a natural range of weight for your body, for your lifestyle, and you know where you usually average, and I would say that it's possibly more than 20 pounds, and you've not been able to lose it for one of the reasons that we just discussed, listen to these markers. So you want your waistline measurements as reported by the NIH clinical guideline on the identification, evaluation, and treatment of overweight and obesity in adults. That's a long one, but this is who the report is from, and I trust them, so I'm sharing it with you. Is less than 35 inches in women and less than 40 inches in men. If you are of a certain size, or whatever size you may be, to give yourself a fair marker in where you are is to measure your waist. Now, visceral fat is definitely the most important, not the adipose tissue, not the fat that you can pinch and feel. The visceral fat is the hidden fat that's wrapping around organs, that is bringing you possibility of having more chronic issues. We're talking about visceral fat, and it will definitely land right up around and through the waistline. Yes, I'm gonna have to get an amen sound effect or something. So for women, the NIH is saying that 30 less than 35 inches, 35 or less inches for women, 40 or less inches for men. And what happens is, as we're getting older, life changes, behaviors change, all of these things change. Many times you're going to see the weight begin to settle in the waist. Men, we definitely see it in our men, and women, we see it in our women as well. Here's the other one. If you do not have, and I'll write this out. If you do not have 2 or more of the following. Let's see. All right, let me put that up. All right. If you do not have 2 or more of the following, you can consider yourself as overweight and healthy. And that sounds like an oxymoron, does it? It does to me. It sounds like an oxymoron. If you do not have 2 out of the 3, so it means you can only qualify 1 out of the 3. You can't have 2 or more. High blood pressure. That's wrong. Hold on, let me go and fix that. High blood sugar and high triglycerides. High blood pressure, high blood sugar, and high triglycerides. You can only have 1 of the 3 for you to be considered as overweight and healthy. You can only have 1 of the 3. And I would not even rest with having 1 of the 3. Any of us. Let me also say that how I was talking earlier about the external evaluation, that's not always about larger people. That is also smaller people. You've got what they call fat, thin people, and you've got small people who are undergoing a lot of oxidative stress and they don't know it. You've got small people who have high blood pressure. So I need everybody to listen to this information and to listen to these markers. Here are some others that I want to share with you, and I'm almost about to wrap this up. I want you to also consider these things to reduce any unhealthy. I'm talking I'm talking and typing. All right, here it is. Here's some other ones. Here's some additional ones to consider to live a optimal health, optimal life, and an optimal body. No smoking. Stay active. Eat variations. Stay active. Know your family history, particularly chronic disease and medical issues. No smoking. And let me break this down. I am not talking just about cigarettes. I'm talking about the vaping. I'm talking about the cannabis smoking, particularly with the THC. Because if you want to use cannabis, I will definitely do an episode on cannabis. If you want to consider cannabis for health, for a medical perspective, it does not require THC. It does not require the THC. I'll say it a third time. It does not require the THC if you are using it for quote unquote wellness. The cannabis does not have to include THC. So no smoking. Reduce it, quit it. Be active. Eat a variety of nurturing foods. And listen, here's that food disparity thing again, that financial disparity. If it's got to be canned goods and canned vegetables, frozen meat, so be it. I am giving you permission to not feel ashamed for the frozen and the canned. I have a pantry stocked of canned goods. Number 1, for preservation reasons. Number 2, if I am tired, I will pull out a can and I'll talk to you. I've had Allie on a food scientist. If you go back and look at some of these episodes, food scientists who came on and we talked about all this stuff. We debunked that myth. A food scientist herself who talked to us about the relevance and the health of canned goods. Go back and listen to it. Go back and listen to it. I want to summarize by telling you this. Everyone is unique and everybody is unique. We are individuals. So you take all of this information that I have shared with you, process it, chew on it, let it marinate in your spirit, digest it, meditate on it, and look at your life, assess your life, share it with someone who can benefit from it, and consider what you need to do to make sure that you are optimal, that you are relatively, and I use again my thing with the word healthy now. So that's why I give additional words, because none of this is linear. And it all should have the ability to be described in various ways for you to understand and get the picture and see the freedom in multiple words, giving you definition and giving you understanding and giving you meaning. Know your numbers, okay? High blood pressure, your sugar, your triglycerides, your cholesterol. Assess your lifestyle. Align your life and your belief with the optimal health that best maximizes your life. Refrain from mass media's opinions, images, and claims on what they think is healthy, and know it for yourself. And then lastly, connect with village and community. So subscribe now. Subscribe to the Well Life TV on the YouTube channel, and also visit us. Visit my website, holisticallywell.co. That's holistically with a W. I thank you for listening. And more than that, I'm thankful for the new subscribers. Hey, you guys, and thank you for the feedback that you provide. I welcome all feedback, whether you agree or disagree with what I share, as long as it is respectful, because I believe in dialogue. I believe in dialogue. This has been your well woman, reminding you to be well and to be whole. Thank you for watching. Thank you for listening, and I'll see you soon.